Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. Today we are going to talk about a very interesting and important topic, the cigarette smoking. The cigarette smoking and its disastrous consequences. Few diseases are preventable. If we can give up our unhealthy habits, few disorders are preventable. And few of such disorders are stroke, myocardial infarction, COPD and lung cancer, which can be to a large extent prevented by our healthy habits. One such healthy habit is to give up smoking. One of the most important modifiable unhealthy habits which we human beings have is cigarette smoking. So if we could just give up cigarette smoking, we can prevent a lot of disorders. I'll be discussing in detail later, but here I want to stress the importance of the cigarette smoking and its disastrous consequences. Cigarette smoking alone increases the chance of developing cardiovascular disorders, that is coronary artery disease or ischemic stroke, by 1.5 times more than the control person, human being who is a non-smoker. 1.5 times. But the deadly trio, if the person has smoking, hypertension and diabetes, the three put together will increase the risk enormously to the tune of 16 times as compared to the person who does not have these three risk factors, that is diabetes, hypertension and smoking. So by giving up smoking, being a non-smoker, we can prevent the development of all these disastrous, dangerous disorders. This is to stress the importance of being a non-smoker. Right, cigarette smoking. If we trace the history, it's very interesting. It is believed that the cigarette smoking was actually introduced, the smoking tobacco was introduced to Columbus by Native Americans. And then it started spreading to the entire Europe. So it was first introduced by Native Americans to Columbus, the tobacco smoking, and then it spread to the entire Europe. Why cigarette smoking is dangerous? Because it contains a lot of constituents which are harmful. One, the nicotine. Second, the carbon monoxide. Third, the tar, that is the aggregate minus nicotine and moisture. Fourth, it contains a lot of carcinogens. Because of these constituents, cigarette smoking is extremely harmful and dangerous. To understand the severity in terms of the intensity of cigarette smoking, there is a grade known as pack years. If a person smokes one packet of cigarettes per day, every day, for 1 year, we call that as one pack year. If a person smokes one packet of cigarettes every day for 1 year continuously, we call that as one pack year. And if a person smokes one packet a day every day for 20 years, we call that as 20 pack years. And if a person smokes one pack a day every day for 40 years, we call that as 40 pack years. Why I am talking about these pack years? Because if a person has got a history of 20 pack years, he is likely to develop COPD, chronic obstructive pulmonary disease. If a person has got a history of 40 pack years, he is likely to develop lung cancer, bronchogenic carcinoma. So the more we smoke, the more the chances of getting disorders. Basically, smoking is important in terms of lung disorders, chronic obstructive pulmonary disease and lung cancer. But how does that cause lung disorder? How smoking causes lung disorder? We have cilia in the respiratory tract, which keeps moving and clears the debris. It clears the airways. By smoking, we are impairing the clearance of cilia and therefore the clearance of airway, and therefore we get a lot of harmful substances entering into the respiratory tract. So clearance of cilia is impaired. As we smoke, as I said earlier, carbon monoxide gets released. Carbon monoxide crosses from the alveolar to the capillary site, and then it combines with hemoglobin with more affinity, displacing oxygen from the hemoglobin. So oxyhemoglobin gets reduced, oxygen transport gets reduced. So persons will have less of oxygen in the blood, hypoxemia, and may start having breathlessness. So carbon monoxide, by combining with hemoglobin, displaces the oxygen from the hemoglobin and causes a deficiency of oxygen and hypoxemia. Third, smoking increases the mucous secretion. The mucous secretion, so a lot of plaque formation happens, excessive sputum production, bronchiectasis. It also causes a decrease in immunity and leads on to infections. So by all these methods, by all these means, cigarette smoking affects lung. Cigarette smoking also can affect brain. The nicotine, which is an important constituent of the cigarette smoke, enters the brain, gets converted to dopamine and then enkephalins and endorphins. These are all pleasure-giving hormones, the dopamine and endorphins. That's why when persons are tensed up, they start smoking, and to some extent their tension comes down, because enkephalins and dopamine are pleasure-giving hormones. They get happiness and they feel happy and the stress goes down. But then not only does it give pleasure, it can cause all the side effects I've been telling, and therefore it is not a good way, a healthy way of getting pleasure. If you want these enkephalins and endorphins to get released, which are pleasure giving hormones, all we need to do is to work out. Just walk half an hour a day for at least 5 days a week. Hit the gym, swim. When we exercise, when we physically strain ourselves, these chemical substances, the pleasure giving chemical substances, get released and we get pleasure. But then these are all healthy. So by working out also we can get these pleasure giving hormones and get pleasure, and it's a healthy way of getting pleasure. But by smoking, though endorphins and dopamine get released, though they give pleasure, they are harmful because you have other constituents, other components which cause harmful effects on the body. Second thing, since it's converted to dopamine, Parkinson's disease is less commonly seen in smokers as compared to non-smokers, because Parkinson's disease is a deficiency of dopamine. But in smokers, since the nicotine gets converted to dopamine and there's a good amount of dopamine, Parkinson's disease is less commonly seen in smokers as compared to non-smokers. Cancer, as I said, it can cause cancer of the lungs, cancer of the pancreas, cancer of the reproductive system, cancer of the colon. But how does it cause cancer? There are a lot of carcinogens. It affects the DNA repair. It impairs the DNA repair. It also causes a decrease in immunity, the immune surveillance. Because of the decrease in the DNA repair and immunosurveillance, They're all prone to cancers, especially lung cancer. The other effects of smoking are cataract, osteoporosis, hip fracture, anosmia, loss of smell because the nerve pits get affected, gingivitis. There can be, because of the tar of the cigarette smoke, it can cause gingivitis, and it can cause aging, premature aging because of the wrinkling of the skin because of the decreased blood flow to the skin. In the reproductive system, it has got disastrous effects. It affects the women's fertility. The egg can get, the ovum can get affected, and the women can become infertile. In men, it causes narrowing of the vessels, which I'll be dwelling in detail in just few minutes from now. It causes narrowing of the vessels, and therefore there's a decreased blood flow. Because of the narrowing of the vessel, there is a decreased blood flow. So this can happen even in the genitalia. So there will be a decreased flow in the men's genitalia and can cause erectile dysfunction. So smoking can cause many of the reproductive effects, harmful effects, by causing infertility in women and erectile dysfunction in men. It can also cause peripheral arterial disease. But how does smoking affect the vessels? What is the pathogenesis of smoking, cigarette smoking, causing the smallness of the vessels, atherosclerosis of the vessels, decreased blood supply, erectile dysfunction, in brain, ischemic stroke, in heart, coronary artery disease, and myocardial infarction? How cigarette smoking causes these changes in the vessels? If we see this diagram, we'll be able to understand it better. The cigarette smoking affects the vessels by inducing a change known as atherosclerosis. Atherosclerosis means narrowing of the blood vessel, loss of elasticity of the blood vessel, and an intimal plaque with lipid-laden macrophages. What we call it as thrombus. If it is in that place, it is thrombus, but if it moves, we call it as an embolus. So, smoking causes vessel narrowing through a process known as atherosclerosis. Because of that, we have myocardial infarction, heart attack. Because of that, we have ischemic stroke because of the narrowing of carotid arteries or circulophagus. So we have major disastrous consequences because of smoking. But how does smoking cause atherosclerosis? Smoking causes atherosclerosis by repeated injury to the endothelial cells of the vessel. Normally we have vessels where it is lined by the endothelial cells, and in the vessel the blood keeps flowing normally. So in non-smokers where there is no atherosclerosis, blood flows normally and all the tissues get good blood supply. But once a person starts smoking, these endothelial cells which line the vessel lumen get affected. Repeated injury repeated to the endothelial cell causes endothelial cell disruption, and therefore the low density lipoprotein enters into the tunica, in the intima, tunica intima of the artery from the lumen. So this is the first step, endothelial injury, allowing the low density lipoprotein from the blood into the intima of the artery. The low density lipoprotein, because of smoking, not only does it cause endothelial injury, it oxidizes the low density lipoprotein. We have oxidized LDL, which can produce free radicals and further impair the endothelial cell by decreasing the production of nitric oxide. Nitric oxide is produced around the endothelial cells so that the platelets don't adhere. The moment the nitric oxide is lost, platelets also start coming in. We have the white blood cells, macrophages coming in, because of the endothelial cell damage, it engulfs the low density lipoprotein and with matrix and the muscle cells and with the platelets. Now because the nitric oxide is also lost, they form a clump. Now they form a clump of macrophages, low density lipoprotein, muscle cells, collagen and platelets. They form a clump known as a plaque. So the vessel wall is like this. Now a plaque has started forming. It builds up, and it protrudes into the lumen of the vessel, so much so that now there's a decreased blood flow. The plaque, which contains platelets, macrophages, low density lipoproteins, becomes bigger and bigger in size and does not allow the blood to go freely. Now the vessel lumen is compromised. If it is compromised so much so that the blood does not go into any particular tissue, for example heart, the heart cells get affected, we develop myocardial infarction, necrosis of cardiac cells. If the brain cells get affected, they don't get oxygen, you have stroke, the death of the neurons. If the thrombus starts getting plucked away from the vessel and starts going and affecting the distal vessels, we call it as embolism. It's embolized. There are three important common causes of death. There are three common causes of death: heart attack, cancer and stroke. Heart attack, cancer and stroke. Out of these, the heart attack and stroke are directly related to atherosclerosis and directly related to smoking. So if we can stop smoking, we can prevent heart attacks, we can prevent brain attacks, the stroke. So smoking causes atherosclerosis primarily by endothelial cell injury, low density lipoprotein ingress, oxidation of the low density lipoprotein and plaque formation causing stroke and myocardial infarction. I said by smoking, the risk of getting cardiovascular disorders increases by 1.5 times as compared to the counterpart who is a non-smoker. And along with smoking, if hypertension and diabetes are also added, the deadly trio increases the risk disproportionately high to the extent to the tune of 16 times. So a person has got smoking, hypertension and diabetes, all the three risk factors, the deadly trio increases the risk of person developing cardiovascular disorders to the extent of 16 times as compared to a non-smoker. So smoke is one of the important modifiable unhealthy risk factors. Just giving up smoking, you can prevent a lot of disorders, especially MI and stroke. So to summarize from the top to the bottom, the important disorders are the brain stroke. The brain stroke. In the lungs, it is the COPD and cancer. In the heart, it is myocardial infarction. In the reproductive system, in the males, it is erectile dysfunction. In the women, it is infertility. And in the vessels, peripheral arterial disorders. We have other effects like cataract, gingivitis, aneurysms, and hip fracture because of osteoporosis. I want to conclude by 2 points. The three common causes of death are heart attack, cancer, and brain attack. The heart attack and brain attack are directly related to atherosclerosis and to smoking. Therefore, if we quit smoking, we can prevent these two disorders, heart attack and stroke, which are the killer disorders of the world. Instead of getting atherosclerosis, these disorders and treating, prevention is better than cure. Just giving up this unhealthy habit, we are able to control these two major killers of the entire human race. So we have to give up smoking, the unhealthy habit. And I hope the ones who are listening to me will be convinced at the end of my lecture and will turn out to be non-smokers, will give up smoking. I've really enjoyed giving this lecture, and I hope you have also enjoyed listening to my lecture. If you have any suggestions or comments, kindly post onto my YouTube channel. But please like and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.